Greetings, everyone. I want to do a video about our class in advanced psychopathology this last week. And today I want to talk a little bit about conduct disorder, disruptive impulse control disorder, and intermittent explosive disorder. Okay. Um, so these disorders are unique because they are um involve problems in emotional and behavioral regulation, specifically behavior that violate social norms, harm to others, or demonstrate an inability to control anger or impulses. Okay. So, to begin, the disruptive impulse control and conduct disorders category is characterized by behaviors that are extremely expressive and they're externally expressive, meaning that they're outward. These are not internalizing disorders like anxiety or depression. Their their symptoms in anxiety and depression are more primarily indirect, okay, and inward. Instead of these disorders show outward behaviors, aggression, rule violation, destruction of property, conflict with authority. Okay. Um, there are basically like three core features across the category. Okay. And that's difficulty regulating emotions, especially anger, difficulty regulating impulses, and behavior that violates the right of others or societal expectations. Okay. So let's first take a look at conduct disorder. Conduct disorder is one of the more severe disorders in this category. The DSM-5 TR defines it as a repetitive and persistent pattern of behavior where the basic rights of others or major uh, age appropriate societal rules are violated. Some of the core symptoms in this cluster are aggression toward people or animals, bullying, physical fights, cruelty toward animals or people, a destruction of property like vandalism or setting fires, deceitfulness or theft, breaking into homes, shoplifting, lying for personal gain. And I'd say finally, like serious violations of rule, running away from home, truancy, staying out late. The severity ranges from mild, where line or minor thefts occur, to severe cases involving forced sexual activity, physical assaults, and weapons. Usually onset in childhood and sometime in adolescence. The age of the onset matters. When it onset in childhood, symptoms begin before the age of 10 usually, and prognosis is usually worse. There is a higher chance of progressing to antisocial personality disorder in adulthood. When the onset is adolescence, no symptom before age 10, okay? And the behavior begins in the teenage years. Symptoms are usually less severe, okay? Um, there's usually a callous or unemotional trait. And the DSM-5 TR allows for a specific with limited pro-social emotions. And this includes a lack of remorse or guilt, callousness or lack of empathy, unconcerned about performance, and shallow or deceitfulness effect. Okay. In this subcategory, it is especially important because it predicts more persistent and severe behavioral issues and a poorer response to traditional treatment methods. Some of the risk factors include harsh or inconsistent parenting, exposure to trauma or community violence, poor attachment early in life, parental criminality or substance use, and school failure, peer rejection, and gang involvement. When you look at it from a multicultural and social justice lens, we must also acknowledge the disproportionate ways Black and Brown youth are diagnosed with conduct disorder. And that includes racism in schools, teacher bias, zero tolerance policies often lead to behavior being labeled as criminal rather than a mental health issue. What is seen as trauma response in one setting is labeled delinquency in another. So it takes proper evaluation that requires understanding context, family stress, poverty, community violence, and systemic racism, not just the symptoms. Okay. When we look at oppositional defiant disorder in comparison to conduct disorder, a common question is, how is oppositional defiant disorder different from conduct disorder? Well, opposition defiant disorder, ODD, involves angry or irritable mood, argumentative behavior, deliberate defiance, and spiteful or vindictive behavior. The main key difference with ODD is ODD does not include aggressive acts that violate major societal norms, like destroying property or harming others. That is conduct disorder. Intermittent explosive disorder, IED, it involves recurrent behavior, outbursts of aggression that are impulsive, not premeditated, not planned, and not for personal gain. These outbursts are out of proportionate to the trigger. Examples include throwing objects, punching walls, physical aggression toward others, explosive verbal attacks. The diagnostic criteria for this in plain language is failure to control aggressive impulses, outbursts that are rapid, impulsive, and unplanned, distress or impairment in social, occupational, or legal atmospheres. And the person is usually 6 or older. However, unlike conduct disorder, people with IED are often remorseful after the episode. The aggression is reactive toward and is tied toward emotion, not proactive for gain. Okay. So a lot of times when we look at this, we got to look at the treatment approaches. And for conduct disorder, some of the treatment approaches are parent management training, family therapy, multi-systematic therapy, community-based interventions, trauma-informed care, and skills training, problem solving, emotional regulation, and social skills. For intermittent explosive disorder, cognitive behavioral therapy that focus on anger triggers and cognitive restructuring, relaxation and coping strategies. Okay. And sometimes in severe cases, mood stabilizers might be prescribed. Some of the things to remember in consideration is that youth that are Black and brown and are usually suspended and expelled at higher rates. And we got to make sure that we're not, prematurely diagnosing them with these disorders. Black children are often criminalized instead of given treatment, and diagnosis must not be used to justify punishment over care. Okay. So, in summary, conduct disorder and intermittent explosive disorder are disorders of emotional and behavioral dysregulation, but they differ in intentionality, severity, and motivation. Our role as clinicians is not only to diagnose, but to understand context, trauma history, cultural factors that shape behavior. Always assessing the environmental factors, family stress, and racism related trauma before labeling a child as antisocial or dangerous is very important. So that will kind of sum up our video for this. And next time we'll be talking about personality disorders.